Good morning, everyone. Just bear with us. We are getting the presentation up on the screen now. And while we get that presentation up on the screen, I just want to go over a couple of quick housekeeping tips this morning. This course is a CE course with the state of Virginia. You will find your course handout in the handout section of your webinar toolbar over on the right side of your screen. Today's course will also involve 3 polls. These polls will happen randomly throughout the course. So you will see that we'll stop the course, the poll will pop up, and then you'll need to answer the poll questions. You don't have to be correct, you just need to answer them so that we can show that you are attending the course and paying attention. You do have to stay in the course for the entire 50 minutes in order to receive your CE credits. If you have questions, please pop them in the question box and I will make sure that those get answered for our presenter today as we go through the presentation. Today's presentation is on benefits modernization and voluntary benefits, sponsored by Colonial Life, and Blake Rogers is going to be our presenter. Blake has 14 years experience with Colonial Life, and he works with them for the territory for Tennessee and Virginia, and is really good and knowledgeable about all of these things. So I hope you guys will enjoy his presentation today. Blake, I'm going to turn it over to you so that you can get started.
Awesome. Thanks, Amanda. Appreciate that. Hopefully everybody's having a good week, and I appreciate you guys participating in our presentation today. Some of what I'll talk about is obviously information that many of you will know. It's really probably more of a discussion than an educational meeting from that standpoint. I know all of you are professionals in our industry and probably have experienced quite a bit of what I'll talk about today. Things have changed though over the last couple of years, and it is interesting how I'm seeing them evolve, and your market's no different than the other markets that I work in, but I think we're going to continue to see quite a bit of change, and some of what we talk about today will continue to evolve in different ways. Amanda had talked a little bit about sort of my background. I actually graduated from North Carolina State and went to work for Aetna in the healthcare field doing large case medical groups, and I've worked for Aetna Health Plans, Prudential Healthcare, United Healthcare, Comp Benefits, which is owned by Humana now. And in the last 16 years, I've worked for Colonial Life in the voluntary space. Although we are a voluntary benefits company, we do put a lot of emphasis on communication and enrollment support. So we'll talk a lot about that today. There's quite a bit to this part of our industry, and it can be very expansive. So we want to talk a little bit about that. I'm not sure if you guys are able to jump in based on the technology we're using today, but certainly anyone who has questions or has comments, certainly feel free to jump in and add anything you'd like to add. All right, let's get started. So our topic today is benefits modernization and voluntary benefits, and we see that going hand in hand. Voluntary benefits, as you all know, can be a great way to help support the core benefits as well as the overall benefits communication strategy, as well as supporting any cost related to enrollment. We've seen this obviously for the past 30, 40 years. But it's even more so today than it was when I started in the business in the early 90s. All right, the current HR environment, today there's an app for everything, right? Numerous opportunities to use technology to digitize HR practices. Obviously, not all companies or HR managers are adopting these different opportunities to digitize, but it's easier now than it ever has been. I think it's one of those things that we as insurance professionals need to continue to promote to our customers, because it makes it easier for them, their employees, and also for us. It just makes things so much more efficient if we can make it a little less cumbersome than it has been in the past. HR, of course, is being pushed to be digital, just like all of us just in our everyday lives, and not just to do digital, if that makes any sense. I think overall our programs have the ability to be much more streamlined, concise. Education can be much better than it ever has been. We can reach employees so much better than we ever have been able to. And it's just a matter of helping promote that to our plan administrators that we're working with so that they give their employees everything they can and we give the greatest value to our customers. 56% of companies surveyed are redesigning their HR programs to leverage digital and mobile tools. 31% are using artificial intelligence. So this was a little eye-opener to me. I know that some of us have dealt with artificial intelligence, but I'm not sure the last time you guys got on one of the chats for the many utilities or other services we use. We're running into a lot of chat bots these days. So unless it fits within that framework, we're not getting a response or a live person to help us. But artificial intelligence is becoming more prolific, and we are seeing it in multiple different paths during our life here. Also, 41% are actively building mobile apps to deliver HR services, and we're seeing that. Obviously, there's a bunch of niche companies out there that are promoting different apps that can help support HR-related services. And I know many of you have seen demos on these, and that's, again, a matter of adoption. It's the same old thing with early adopters and those who eventually get on board. I think we all have some experience with that. So although the technology is advancing at an unprecedented rate, many organizations are not keeping pace, as I had mentioned. I think a lot of our plan administrators are still stuck in the past. I know for myself, I'm often surprised by the size of company that says they're still using paper to do enrollments. And occasionally I'll get asked, hey, can we just use paper for that, and so on? And my response is typically, if I knew where I could find those paper apps, maybe it could be, but why in the world would you want to do that when we can offer every other version of enrollment support, whether it be call center, virtual, co-browse type enrollment, one-on-one. There's multiple different ways to do it, and a lot of times paper is just not the most efficient, effective way to do that. More than half of employers surveyed lack technology carried out for basic HR practices beyond payroll. I know you all have experienced that. Several of you work in under 100 market, and you're dealing with customers all the time that are really just not up to speed with being able to manage their benefits in a way that's efficient. Employee file management, 53% of our plan administrators and customers are still maintaining paper files. Onboarding is still done in person. We got a new employee that's starting. They're filling out their application to come on board. The policy manuals handed out in a paper format. And then also, of course, when employees leave, all of that information, exit paperwork, at least for almost half of those employees or employers, is still paper. So only 47% of companies are using technology during enrollment season. So there's a lot of opportunity here for us in our industry to, I think, be a cut above of our competitors, to help support our customers and help pull them into the 21st century. You know, paper was great back in the 90s, but at this point, we have every option in the world to be able to support digitizing that enrollment process. More than half of companies with benefit admin platforms say they are looking to modernize. And why wouldn't they? I know we hear this from our customers, and when it gets down to it, oh, we don't have time this year. We'll look we'll work on this next year. Let's get through open enrollment season, and then we'll take a look at it afterwards. And of course, once we're done with open enrollment season, you nor they want to get back into, okay, how can we make this more effective and efficient? Especially after fourth quarter, I know all of us are a little burned out, and it's a little hard to get back to, okay, here's what we could have done that would have made this better. I know so many of us are just trying to get through it and that type of thing. But if we can take that first step and at least make some progress, it's going to make our life and our customers' life much better next year. So lost efficiency, talked a little bit about this, automating repetitive and laborious tasks frees everyone up to be more productive. Also, of course, anytime we're doing paper or other manual processes, the instance for errors goes way up. And we all know this. I mean, think about how many times you've tried to read a paper app and you cannot read that handwriting. And the worst thing is sometimes it's our own handwriting, right? We're helping employees get enrolled or whatever that might be. And then oftentimes we're having to either scan that and or do data entry into a spreadsheet or add it into a plan admin system from the carrier. And each one of those steps allows for an opportunity for error. And I'm sure you all have experienced it. I know for myself, just I can't tell you the number of different credit cards and utility accounts that I have where my name's spelled incorrectly. I have multiple different accounts where my last name has a D in it. My last name's Rogers. And you know what? You just let it roll. I think I even have different ownership and properties and things like that where my name's incorrect. But anyway, anytime we're dealing with paper, we always have room for error. So a lot of smaller employers feel like they're not large enough. We're too small for that. I'm sure you all have heard that. And or you probably heard some of your competitors maybe tell their customers that, or you may be told that by their customers that they were told they were too small to be digitized, and that really they just need to stick with paper and use the old-fashioned method, whatever, or that technology is too expensive. Or we do hear plan administrators say, "Hey, I'm a one-arm paper hanger. I'm doing payroll, and I'm handling benefits, and I'm also supporting other admin functions within the company, and just not able to handle anything different or new." Although we know as benefits professionals that we're going to improve their life if we can get them on board with at least just digitizing just a few of their processes. It's going to make a big difference. Larger employers are not too different. They might have a little more opportunity from the standpoint of having staff to be able to manage things. But then there is also that concern about the expense. Budgets are tight. I think everybody's been hit by the latest pandemic. And then also, of course, we may have brokers that are supporting, the traditional style of enrollment and in communication, where they're passing out packets, paper packets in an enrollment meeting, and they're doing a group meeting. And those employees just go home and try to figure out how to make those decisions on which benefits are going to be best for them and complete those paper apps and get them back in and so on. I think we got a lot of our peer professionals in our industry that are still doing that. And they're doing it because it's still easy to do. Employee preference for paper forms is still very high. Employees are used to what they're used to, and until we push them to do something different, they're going to stick with that. Employers don't use enrollment technology very much. Companies are saying they're not large enough, too expensive, not enough staff, in-person meetings are more engaging, broker admin preference is at 15%. So all barriers to benefits modernization.
Now's a great time for us to stop and launch the first poll question. So I'm going to launch that now. You guys have about 30 seconds to answer the question. Do you personalize your voluntary benefit presentations? This goes hand in hand with what Blake was just talking about, paper versus virtual, but do you personalize those for your clients? Yes or no? Just click the button. We've got 10% voted. Make sure that you are doing the poll, and I'll check questions while we wait. We don't have any questions currently. Couple more seconds, you guys. We only have about 40% of you that have voted. Make sure that you click the button. So far, 100% yes, 22% no. I'm going to go ahead and close the poll. 80% yes and 20% no. Thank you, guys. Blake, back to you.
Okay, thanks, Amanda. So the drive to modernize. So employee engagement, it's not just another HR thing. It's about improving communication, understanding. Right now, there's never really been a more important time to just improve overall employee engagement to the employee benefits. We all know benefits are a big part of compensation, and there's a huge competition right now for employees. There's a huge effort to just get employees to show up. I know you all have heard it from your customers. Right now, it's just been more difficult than ever to get people to come actually do the job. And then in a lot of cases, we have employees that have been there for years and still are flaking on their employment. And many people are moving to different jobs, because now with a lot of people that have been affected by COVID, they're either not willing to go do what they need to do from a job standpoint, or they're looking for opportunities because those opportunities are now opened up at competing companies. So right now, employee engagement is more important than it really ever has been. I know we've been talking about this for a number of years, but the more these employees understand and appreciate their benefits, the more likely they are to stay with that company. I think we all have customers who spend a lot of money on their benefit package for their employees, and yet they will really drop the ball from the standpoint of communicating that to their employees and making sure they understand the value of those benefits. It's something I think that we could all be better at. It's just helping our employer customers really grasp the value of what they're providing and help those employees benefit the best way they can. Benefits account for up to 30% of compensation, so almost a third. But as I just mentioned, the employers are allocating very limited resources and personnel to ensure those employees understand those and value those benefits. And it's not just the overworked benefits manager or HR director or office manager. A lot of times it's the owner. And I think it's important for us as professionals to remind that owner, that CFO, that HR director, that office manager, that these employee benefits account for basically a third of that compensation for that employee. So making sure we do a good job communicating and helping that employee get the most out of that benefit package is really going to benefit us all in the long run. We're going to have much more likelihood of keeping that employee in their job long term. So the balance of high tech and high touch enrollment strategy, there's multiple different facets to this. There's multiple different opportunities. And although my company offers all of these and we can provide this for most size groups, a lot of brokers don't take the time. I think they're initially impressed when we review it, but a lot of times it gets lost. Well, we're just overwhelmed. We got to get this medical renewal and so on and so forth. And I got 10 other groups or 50 other groups I got to take care of. And so a lot of times, even though we have great intentions, a lot of these things don't get put in place. So, and you all have used some of these. I'm sure you probably not used them all on a single group, but these are the different types of pre-communication, just overall benefits communication that are available. Email campaigns, websites, benefit booklets, announcement letters, on-site promotion through flyers, posters, obviously group meetings and presentations, one-on-one benefits counseling. This has obviously been hindered a little bit over the last couple of years, but we are getting more and more requests for that. And then also benefit statements. Benefit statements a lot of times are provided complimentary, but if the employer doesn't provide that information to that carrier, that enrollment company, that won't happen. obviously there's not enough information to be able to be provided. So reviewing the benefits package that is available to the employees is helpful. Discussing those changes. I know a lot of times the changes that are going in with the benefits package often center around that medical. It's a deductible going up, it's a higher copay, or copay's going away, or moving to an HSA plan. Obviously, that's the biggie. Promoting the wellness and other offerings, such as a health savings account and how that can be used. I know for even folks within our industry, there's confusion around how benefits work. So much less somebody that doesn't have that background or education, it can be very problematic. Preparing those employees for their enrollments decisions. And this is tough. You know, I know for my company, we have 3 different medical plan options. And even though I've been doing this for 27 years, I still have to really think through, okay, our deductible plan this year, I don't know, we had a lot of expenses last year. How much did I put in the HSA? Well, you want to max it out if you're going to do it. You know, all those different decisions are tough for all of us. So much less Joe Lunchbox, who's just trying to make it through the day. It's definitely something that we need to really kind of think about when we're putting our enrollment strategies together. And then, of course, customizing the employer and employee preferences. We're seeing this more and more these days, especially with the different decision-making tool platforms. I know that some of you may have seen some of these. There's more decision-making platforms that are coming out. And of course, in some cases, they're lending themselves to self-enroll, but they can be very beneficial even if we have a one-on-one type enrollment for pre-enrollment communication. So voluntary benefits, we talked a little bit about voluntary benefits. The excellent thing about voluntary benefits is just the fact that they are no cost to that employer. So they have the opportunity to expand their benefit package without any impact to their bottom line. And it allows employees to buy benefits on a pre-tax basis and effectively reduce the overall cost for purchasing those. I run into groups all the time that say, well, we have a medical and a dental plan, and you know, $15,000 life insurance comes with the medical, and our employees should be good. Well, and when we look at the top 3 benefits that any employee, or really top insurance that any employee or any person can own, obviously medical is the number 1, because that can make you bankrupt quicker than anything. But then disability would be number 2. And that one's the one that gets overlooked probably more than any other benefit. And I know I'm preaching to the choir here. Thirdly would be life insurance, $15,000 life insurance. That's not even gonna, I mean, that's gonna do enough to take care of final expenses maybe for Joe Lunchbox, but in most cases, it's not gonna nearly be enough. Thinking about mortgage, thinking about kids and future education, thinking about a stay-at-home spouse, all of that support is going to be necessary. So voluntary benefits just gives us an opportunity to expand those coverage offerings without an expense to that employer, but allowing those employees to purchase easily and through payroll reduction. Most employees are not going to go out to the local insurance agency and try to buy individual disability, individual accident, or even individual life. So the healthcare landscape, so 1 in 2, it's 151 million Americans receive healthcare coverage through an employer-sponsored health plan. And that kind of speaks to what I was just saying. Most people are not going out on the open market for themselves and buying insurance. Obviously, with the exchange, it became a little easier to get individual health insurance. But even with that availability, there's still multiple different, most Americans really don't do that. They don't buy their insurance at work, then they don't have it. So again, getting back to that case for disability, I've never gotten a call, rarely gotten a call from anybody who says, hey, I want to buy individual disability. Very, very rarely do you get that. And typically when I do get that call, it's somebody who has an issue that they need coverage for right now. So pre-existing is going to eliminate that particular issue from being covered anyway. So I hate to disappoint those folks, but we've had to communicate that multiple times. So as we said, most Americans are going to receive their medical and really other insurance from their employers. And of course, for the typical US employer, healthcare represents the second largest operating expense behind wages. And so it's extremely important. Vast majority of employers, it represents the fastest growing operating expense. Of course, we all deliver those renewals, usually 10+%. And it's very hard to manage. I mean, we can raise deductibles, we can increase copays, we can move to an HSA plan, all of these different things, but we still see that trend continue, 10, 15, 20%. And if we can give an employer 10%, a lot of times we feel really, really good about it, right? But 10% over 5 years just gets to be unmanageable. So cradle to grave benefits are really a thing of the past. The expense is really not sustainable for most employers. And we've seen it where employers have just had to scrap benefit plans. Those groups under 50 that used to pay for that, a lot of times are sending their folks out to the exchange and so on. So it can be very challenging. The cost of healthcare versus annual salary, you'll see that salary is just not keeping up with the cost of healthcare insurance, right? 25% increase for salaries from 2006 to 2018, and then you can see healthcare costs from 2006 to 2018 has gone up 75%. So it's a much bigger chunk of our household income these days, and most of that cost, or a lot of it, is getting passed on by the employers because they have no other choice. You can see the median annual salary for a full-time worker went from 35K to 44K, and again, overall cost from that healthcare 8K to 14K. So any increase in salary is getting eaten up by those expenses related to healthcare cost. The other thing I was just going to mention about this slide too is that we think about our younger generation, millennials, or whatever the latest generation is, they're really not staying in jobs as much anymore. And they're much more likely to go through periods of self-employment or maybe temporary employment and so on. And so that healthcare is changing, whether they go from an employer's plan to COBRA, maybe to an exchange type plan and so on. A lot of times that benefit is going to change for those individuals.
Now is a great time to launch our second poll. I'm launching that now. Make sure that you take time to answer the question, are you using technology to engage employees in benefit discussions? How are you guys using technology? I'm going to check the question box. If you have any questions, just pop them in the question box. Currently, we don't have any questions. We have about 20 more seconds for this poll, so make sure that you are answering the poll. We only have about 20%. There we go, you guys. Couple more seconds. No right or wrong answer. All right. This one is also 80-20. 80% of our participants are using tech and 20% are not. Thank you, guys. I'll turn it back over to Blake.
Thank you. So that's good to see. 80% are using some sort of technology, whether it's an enrollment platform or maybe other digital communication for pre-enrollment, or maybe a benefits website, web portal, so on and so forth. Any of these things, even just one of them, can be very helpful from the communication standpoint. So over a third of adults say that paying their deductible is challenging. And we talked about it. Employers have had no choice, and you all as insurance professionals have had no choice but to shift more cost to those employees. And so I know for myself, my deductible, I want to say, is $6,000. It's one thing for me to be able to pay that, but you think about those low-wage workers out there, they're in the same boat. And so in most cases, that's really going to be a big challenge for them to be able to meet that deductible out of pocket. Half of U.S. adults say that a family member has put off or skipped some sort of health care or dental care in the past year due to cost. And of course, this can be multiple reasons, but I know there's certain procedures that are not emergency that can be put off, certainly on the dental side. I know that I talk to people all the time that need a crown, but they've already met their max this year, so they're going to wait till next year, so on and so forth. I know you guys have all worked through that with your employee customers. 29% of respondents also reported not taking medicines as prescribed at some point in the past year. So again, almost a third people are not taking their medicine because they can't afford to get another prescription. And again, with the cost shifting, even though we have opportunity for generics now that are super cheap, there's still a lot of drugs, especially specialty drugs, that there's not a generic for. And so it can be very expensive. And I know that we have 3-tiered pharmacy benefits, and sometimes it's all subject to the deductible, thinking HSA plans and so on, high deductible health plans. So it can be very cost prohibitive, and especially depending on that type of medication that employee's taking. So the way that voluntary benefit insurance can help with this, and you all know, it's really filling those gaps. So healthcare insurance, it can obviously help with deductibles, co-payments, co-insurance, all of those things. We think about that high deductible again. Very rarely do I see a deductible below $2,000. I know there's that unicorn out there occasionally we'll run into that still has a $500 deductible, but oftentimes we're seeing that it's a municipality or some sort of organization that benefits are a big part of just overall compensation. A lot of times we're seeing that within governmental type groups. The expenses related to health insurance that get billed to the employee can be obviously cost for seeing physicians or hospitalization, surgery, and then we talked about meds. All of these things can be supported through the different benefits that are offered through a voluntary offering. So the employer advantages and employee advantages to voluntary benefits is that they can be very affordable, and especially when purchased on a pre-tax basis. Most voluntary benefits can be purchased on a pre-tax basis, certainly not disability or critical illness or life insurance, but hospital confinement, any sort of medical gap type plans, accident, cancer, other benefits that are related to healthcare can be pre-taxed. Also, of course, just helping that financial well-being, rounding out that portfolio for that individual. It's just like financial planning. Having insurance in place, especially insurance like disability and life insurance, can certainly be helpful from that standpoint. Also, of course, the variety of benefits being offered can be expanded. It helps from that standpoint for that employer to be competitive when they're competing for talent. And then obviously we've talked a little bit about our generational diversity. Different things are important to different people. I know for me, I probably paid more attention to 401k in the last 5-10 years than I did 20 years ago. I also look at things a little bit differently. Voluntary benefits are typically lower maintenance, unlike medical insurance, where it's being used monthly by a lot of our employees. There's not that level of claims typically. So from a service standpoint, for us as benefits professionals, there's not as much for us to have to do for that. So helping support that is not going to be as costly for us. And then traditionally, voluntary benefits are portable, and most still are. I know we traditionally have had voluntary benefits that were built on individual chassis, and the big benefit for those were you never got a rate increase, and they were always portable at the same rate and same benefits. So employees could take it with them without having to go through any additional underwriting. They didn't have to convert coverage and so on. And so portability has traditionally been a feature for voluntary benefits. Although with the group chassis products, there are certain products that do not offer portability. An example of this might be a medical gap type plan. Oftentimes we don't see that type of plan with portability, although it can be offered through coverage, so they can maintain that for some time if the employer allows it. So one size doesn't fit all. We've talked a little bit about how we have multiple different generations that have different focus on lifestyle, what's important. We all want more personalization, smartphone apps, tennis shoes, television stations. So we want what's important to us. We want on-demand TV. We want to see the show we want to see when we want to see it. And that's just becoming more and more. Today's employee expects every element of their job, from work to development, benefit options, to be customized based on their own personal expectations and lifestyle. 80% of employees value benefits customized for their age and circumstances. Again, this gets back to that generational challenge, meeting everybody's need and offering a variety of different benefits that can be purchased by the individual can help satisfy everybody's needs. Choice matters. I think everybody wants the opportunity to have choice. Whether they participate or not, they like knowing at least it's available if they change their mind. So voluntary benefits are a great way to customize a benefits package with additional products and other programs, and allowing employees to pick what's important to them. So 91% of employees feel companies should offer customized benefit packages, and only 72% of those HR professionals surveyed do. I know we've all experienced the plan administrator, office manager, HR director who speaks for all their employees, and they tend to at least appear like they know what everybody wants, and they don't need that. Yeah, they don't need that. We've heard that before. Accident plan, they don't need that. We're not going to offer that to them. That type of thing. And so I think it's helpful for us as insurance professionals to help them get over that hump, help those plan administrators understand that what's important to you, being a 45-year-old HR professional, is maybe not what's most important to that 25-year-old line worker, or that 55-year-old employee. Everybody has their own needs and own idea about what's important to them, and they have different lifestyles. They have different family medical histories. People want insurance for those different things, just to help them sleep better at night, if nothing else, right? I know for myself, I'm just like probably many of you, being an insurance person, got way more insurance than I probably need, but hey, I sleep better at night. I appreciate the value of it, just like many of you do, just because we see what happens when you don't have that. Or we see the benefits of it, the positive side of how that helped somebody that we've worked with in the past. 73% of employees feel that having customized benefits will increase their loyalty to their employer. To me, this is an extremely important statistic. So almost 2/3 or 3/4 of our employees feel like a customized benefit package is going to help them stay more loyal to their employer. I think this alone speaks to the fact that employers have to be competitive with their benefit packages and have to be thoughtful about their approach in communication and education for those employees to retain good employees and to attract new employees. Currently, only 32% of employees surveyed agreed their group health benefits are definitely worth the cost. And I'm surprised it's this high, honestly. I mean, I think we can all think about it from our own standpoint, how much we feel like we're paying in premiums for our coverage. And I know a lot of us actually have a contribution from our employer, but it's expensive. And then when we use the medical coverage, in most cases, we're coming out of pocket a significant amount. So we see it every day. And of course, we know the reason for it because we're educated around trend and the cost of healthcare. But you think about those employees on the line, those folks really don't understand how that works. And so, again, I'm surprised 1/3 actually agree that they're worth what they cost. So more choice allows employee to tailor that benefit package to the greatest value for them and their families, and control when selecting their own benefits is important to them as well. They don't want those decisions to be made for them by a plan administrator. Obviously, benefits, and we've talked about this, are a great way to expand benefits at no cost to the organization, and that that expansive benefit package is going to help in lowering employee turnover. So you think about it, we leave one employer to go to another. We're working for ABC Manufacturing, we go to XYZ Manufacturing. Well, at ABC, we have the opportunity for disability or voluntary life insurance. We can have a couple of different medical plans. We have the option of a bridge style plan or a hospital confinement type plan that can help with that deductible. We go to XYZ, well, they have medical and dental and life, but there's no opportunity for disability, or there's no opportunity for other benefits that can help fill the gaps. It's not going to be as attractive as it would have been had they just stayed with ABC Company. Employees have the ability to pay for what they want. We do have employers that we see that will make some contribution. A lot of times you'll see this in a cafeteria style setting where they'll make a defined contribution. It could be, let's say, $50 a month, and employees can choose what benefits are important to them on a voluntary basis. So it still allows that employer to supplement, but it still allows choice for those employees. More options that fit that individual's lifestyle and healthcare situation, and then also caring about an employee's financial well-being can promote goodwill. So I think this is important, and this speaks to the need for better education and communication with employees around open enrollment season, because this talks about, we can really promote how that employer, hey, we're offering a new voluntary benefit. We know that several have asked about it and want it, and it's now available to you, whether you'd like to take advantage of it or not. It's still, you're still building goodwill with those employees just by having it available. It might be that, oh, my budget won't allow it right now, or I don't need that voluntary coverage, but it's good to know it's available in case things change. So the strategy around voluntary benefits, and again, I'll apologize if some of it's redundant, but just adding benefits at no direct cost to the organization is very helpful. Impacting the employer's ability to attain and retain top talent, extremely important right now. Giving employees more customized options for the coverage that they may want. Mitigating costs, those costs that are passed on to the employee. We've talked about the high deductibles, high coinsurance, high out-of-pocket, and how voluntary benefits can help support that. Employees can purchase these plans with pre-tax dollars, effectively lowering the overall cost of these plans. And then helping that employer modernize that communication and enrollment experience for the employees without any additional cost. Again, not all voluntary carriers provide support from a communication and enrollment standpoint. Some are just strictly product vendors, but there are communication enrollment companies that can help support that. And then many of you have that built into your own organizations if it's being used effectively. I know a lot of times we'll have some firms that say they provide all those things, but when it gets down to it, they're providing it to maybe 15, 20% of their clients. So business understanding, choosing the right partner. This is difficult. We talked about some carriers. It's really strictly a product. They don't provide any sort of communication enrollment support. It's really just a product offering. So it's important for you to decide, okay, which partner is going to be right. I don't think we can, as business professionals, insurance professionals, just choose the highest commission carrier, because a lot of times that's not going to be the right way to go. And very rarely do we ever see that happen. But sometimes I think some of the overall support and what can be brought to the table is overlooked by some. Understanding you want a carrier that has a proven history. I'm always amazed by the broker firm that puts in Tokyo Mutual or some other firm, insurance company that we've never heard of that's unproven. And it's just a question of, why would you do that? You know, right now when competition is as great as it's ever been for business, you don't want to risk your reputation with or your relationship with your customer that way. There's also that tendency by some insurance broker firms to not offer voluntary benefits because they're afraid of rocking the boat on the medical. And I think this can be a challenge too, because inevitably another competitor is going to be coming in the back door saying, well, you're not offering voluntary benefits. Well, this is something you really need to do because your current broker is not telling you about it. So this can undermine your position within your customer as well. So something gives consideration to. Broad portfolio products, again, expanding that overall product selection. Simplifying administration, that's where our technology and benefit platform enrollment is coming in. Also, of course, I've talked about the new platforms that we're seeing that are decision-making tools that help support enrollment and education for those employees. That can be very helpful. Voluntary benefits can pay for these different things depending on the carrier that you use. Also, many carriers these days offer the option for building out on third-party platforms. I know some of us have a license for various different Ben admin platform. In a lot of cases, the actual carrier is doing the build out and providing that platform at no cost. They can either build out on their own license and or build out on your license for whatever Ben admin platform you're using. So seeing that more and more too, and that can be very effective in helping you reduce just your cost internally. Benefits understanding. You want a carrier that's going to understand this business. They're not just Johnny come lately. I know in the last 10 years, we've seen the major carriers roll out their different voluntary products, but you ask questions of them and you try to get support, and there's very little understanding on their end about even what these products do. They're medical carriers, and that's really their primary business. Benefits education and communication, a partner that can meet one-on-one with employees and explain the benefits program is very helpful, but also a partner that has the ability to provide call center enrollment at no cost to you or the customer, or virtual enrollment through co-browsing, or even supporting through self-enroll. It's not enough, I think, to just say, hey, all the employees are just going to go self-enroll. I think you got to start looking at these tools that help support education for enrollment for employees. Again, choosing a benefits carrier that's going to provide customization and personalization, flexibility, and maybe different alternative pay options. I know payroll deduction is our preferred because it's easy for the employee and it allows for pre-tax benefits. But in some cases, we need to be able to do direct bill, and we're seeing more carriers provide that as well. And then the added value. Some of you probably talked to various different carriers in the recent past that have some different value adds that are offered to all employees, not just the ones that sign up for insurance, but all employees. And it could be anything from an additional AD&D benefit to maybe ID theft protection, or sometimes we're seeing telemedicine that's being provided at, no copay telemedicine that's being provided, various different value added options that help sweeten the pie from the standpoint of offering new voluntary benefits. So they're able to offer a benefit that really is going to benefit everybody but not cost anything. And then think about, okay, do I need enrollment support? So does that benefit carrier, they just offering a product, or do they actually provide additional communication tools and enrollment? And if they don't provide that, how's that going to affect my participation and the overall experience for the employer? Or is it all going to be left on me and my staff? And again, I work with a lot of different broker firms that feel confident about what their staff provides and can provide. But again, I think what happens is we get into the mix and we just run out of time, or we have to move on to other projects and our staff's overwhelmed because they have 15 other accounts they're trying to deal with. So not relying on the carrier to help support some of these things sometimes can be to our own detriment. Helping employees and the employer with the appreciation of the benefits being provided, taking advantage of benefit statements, I think is helpful. Again, this is often overlooked these days. I know that sometimes we feel like, well, it's provided through the benefit admin platform, but to what degree and to what extent is that information being provided? And then overall cost savings, there's the opportunity to allow that carrier that's providing voluntary benefits to do communication and support maybe dependent verification. I know our bigger employers have all adopted this because there's an opportunity to reduce overall costs, especially around medical, on eliminating dependents that aren't truly eligible from that medical plan. Digitizing that enrollment through a benefit admin platform, it's going to speed up the process, eliminate errors, and make it more effective and efficient for everybody. And then also, of course, with that type of enrollment, we're boosting tax savings for employers and employees when it comes to purchasing voluntary benefits on a pre-tax basis. All right, so measuring success, helping employees understand all of their benefit options, simplifying the enrollment process, driving enrollment attendance. This is something that our company started measuring in the last 7-8 years, how many employees actually are attending. Think about the number of employees that we don't ever see or talk to, and their benefits just roll over from one year to the next. And obviously, their needs are changing. It's just a matter of trying to engage them. And then increasing overall plan participation. You think about the number of times that we've had employees that are not participating in the 401k or FSA or HSA. That happens all the time, and it's just a matter of education and ignorance. Only 52% of employees say that they understand their health benefits very or extremely well. And I'm surprised it's that high, to be quite honest. Only 43% indicate they understand their non-health benefits extremely well. I think everybody feels like they know medical insurance. They have a medical ID card. They go to the doctor. They give them the card, and then they get billed whatever that balance. They get an EOB from the carrier and that type of thing. So, but all other benefits, think about the number of employees you've dealt with that really don't understand the impact or the significance of having a disability plan, for instance. Can they last a month, 2 months, 3 months without a paycheck? Most cannot. So that's something to just give some consideration to. Education is so important for these employees, and we need to support our plan administrators from that standpoint. All right, finding a carrier that's going to support customization, enrollment, location, meeting those employees where they are, when they need us, through times, and then how they want to communicate or engage with us, whether it's telephonic, in person, online, virtual, all of those different things. Each employer that you work with is going to have different needs. Some employees are all going to be all in one location, and then you're going to have customers that have employees all over the state, all over the country, maybe one per location. Think about the number of folks that are working from home now. I'm sure you've all dealt with that already this enrollment season. How are we going to engage them? And then again, thinking about a carrier that's going to provide a single source solution and or multiple sources, or some combination with what your firm might provide. So year round, what's important? Do we need an enrollment system? Does the group already have a system, maybe through their payroll administrator? What carrier is going to work best with that? Can we put that carrier's products on that system and take a download? Can we set up an integration where it's a direct feed? How much is that going to cost? Are we going to pay for it? Is the employer going to pay for it? Are we going to have to do year-round enrollment? Or are we going to just focus on open enrollment for that Ben Admin platform? Can that Ben Admin platform accommodate terminations? Is it an HRIS system? What can it provide? Reporting, what sort of reporting are we going to get back? Are we going to provide a download to those different carriers for the enrollment upload? And then, of course, finally, how secure is that data? I know, at least from my own experience, there's not been a tremendous number of data breaches that we hear about in our business, but obviously it's out there, and more we're hearing about these different malware and other online villains that are holding these different large companies for ransom. access data and to operate their system and so on. So we're hearing about that regularly these days. Obviously a concern. So technologies are changing constantly and fundamentally about how we work and how work gets done. Brokers and employers don't need to manage it on their own. I would say to definitely lean on those carriers to help assist in this transition. Our benefit brokers obviously are going to manage this, but being able to rely on your carrier partners is going to be extremely important. Outsourcing that communication can help expand your overall staff this time of year, especially when you're running thin and you have so many customers you have to deal with. Allowing a carrier to support communication and enrollment just makes sense. You definitely want to think about who is going to be able to support you in the best way that's going to be most effective for your customers. Choosing a partner, looking for one that can automate the enrollment process and integrate with integrated platforms. We talked a little bit about this. Those things that are important here on the right. Mobile, can it be handled through a mobile phone? Voice recognition. Is it simple and intuitive? And that brings us to the end of our presentation. I'll leave it on this last slide because this kind of speaks to a lot of sort of what we talked about today. Finding, again, a partner, a voluntary vendor that's going to be flexible and provide these different things is extremely important.
Question? Okay, you guys, I'm going to go ahead and launch the last poll while you guys get your questions in. So our last poll today is, could we use some more solutions for voluntary benefits? So yes or no, everyone take a minute to vote for the poll. I want to also just thank Blake for this great presentation, for sponsoring today's CE credit for you guys. And Blake, if you want to take a couple of minutes and just talk about how Colonial partners with all of us to help us deliver better benefits to our clients. I know our office has used you guys on several occasions. We would love to hear about that.
Thank you, and I appreciate that. Some of you are familiar with Colonial Life. We're a wholly owned subsidiary of Unum Group. We're in all 50 states. Our value proposition is around benefits communication and enrollment support. So we'll provide no cost on-site one-on-one enrollment, as well as call center for any size group. We can work with groups all the way down to 3 eligibles and 1 enrolled, and of course any size of larger group as well. We support co-browse and virtual enrollment. We will build out systems for you. So you may have you could be using a Ben admin platform, say for instance Ease or Employee Navigator or Solaris or bSwift. We will actually build out on your license for full core enrollment, or we'll provide that system on your behalf for your customer and on our license. So we can also accommodate product hosting, where our products are actually hosted on a third-party system. And then also, of course, all those digital methods through digital postcards, benefit booklets, all of these different things we'll provide at no cost. We have a huge number of value-added services. I've talked about different telemedicine, AD&D, ID theft, multiple different other value-add services that can help expand a benefit package for all employees, regardless of whether they enroll in any sort of voluntary benefits. You can certainly get in touch with me through LinkedIn. I noticed that you had my Twitter on the advertisement for the meeting today, but I primarily operate through LinkedIn. Again, it's Blake Rogers, and I'm the regional broker manager that supports Virginia, DC, Kentucky, Tennessee, all of that surrounding area. Always happy to help you all. Thanks, Amanda.
Thank you. I'm going to close the poll. Thank you, everyone. We had 100% participation on all the polls today, so I really appreciate that. 50% of the participants today said they do need some more solutions for voluntary benefits. So hopefully you guys reach out to Blake on his LinkedIn. That's what we use as well. And I hope everyone has a great weekend. Thank you so much.
Thanks, everybody. I appreciate your time and attendance today. Have a great week.